Welcome to Eye Contact. I'm Paul Rosen, and today we're going to talk to Dr. Richard Packard about surgical phaco basics. Richard, welcome to the show.
Thank you, Paul.
Do you have any preferred method of breaking the nucleus during phacoemulsification?
I think it's actually quite a large question because I don't think you can have only one technique.
Okay.
It depends entirely on whether it's a soft or a medium or a hard cataract. By and large, I prefer chopping techniques, particularly vertical chopping. I think that's the most efficient way of dealing with the nucleus, but you can't do that on a soft cataract. You have to have a different technique for that. On soft cataracts, I would use a technique of my own, which I call soft slice, where I use an instrument called a McCool iris repositor, which has got a little blunt end on it, and you just slice through the nucleus and split it. And you use almost no ultrasound at all, even when you're removing the segments, because they're soft. With a medium cataract and a hard cataract, I would use a vertical chop technique.
Okay, if we just go on to talk about phaco machine power settings, what do you use in a standard case, and how would you change it to use for a dense cataract?
It depends entirely, again, on which machine I'm using. If I'm using one of the Alcon machines, let's say the Centurion, then I would set it up for a sculpt setting, which would be a vacuum that doesn't need to be very high, about 70-75 millimeters of mercury, something of that sort, a flow rate of about 25 cc's, and then linear torsional up to 100%, but depending on the tip. If I'm using the balanced tip, then it will be up to 60% because it's more powerful.
Okay.
On the signature machine, I use a completely different setup because the ellipse works differently. For sculpting, I will use a 4 milliseconds on, 8 milliseconds off pulse setting. When I got the pieces chopped up or sculpted or whatever, then for segment removal, I will have an unoccluded setting of the same with a power setting of about 40% for both of those. And then when you get occlusion, it automatically changes to 6 short pulses per second of 4 milliseconds on and 8 milliseconds off. So it's actually quite a nice indicator when you're listening to the machine, because you can hear this sudden change in the way that the phaco power is being delivered. So it gives you an indication as to when your occlusion has actually taken place.
And on that machine, you can flick between Venturi and peristaltic. And when would you do that?
By and large, I tend to use peristaltic, but I do find on the signature that doing the IA with Venturi is quite nice. I've tried using the Venturi for the phaco part of the procedure, but it doesn't work terribly well for chopping, and it seemed like a pain to have to change from peristaltic to Venturi just to take the segments out, because I'm used to using the settings anyway that I like. So,
And how would you change it for a dense cataract?
On the Alcon machines, on the Centurion, on the Infinity, if it's a really dense cataract, I won't just use torsional. I will set up a 50% power pulse longitudinal, which would come in at the beginning of the stream of settings for the segment removal. But also on the Infinity and Centurion, I don't use just straightforward OSL. I use a multiburst setup, so that it starts off at 35 milliseconds on, 45 milliseconds off, and then it gradually increases the space between the pulses until you get to the full pulsing.
And how does that differ from IP?
Oh, IP is totally different. IP is a function that Alcon put on the machine because they were finding that, particularly with the 30-degree flare tip, that with hard cataract it was clogging. And what IP does is that when you get to whatever you set, normally 95% of your preset vacuum, it will then cut in with a small burst of longitudinal power, which pushes away the clogged piece of nucleus and then enables you to re-grasp it with your normal setting.
So it only comes on at the end of,
That's right,
of that
absolutely.
cycle.
It's not there most of the time.
Yeah. Okay.
And if you're using a straight-through needle like the balanced tip or my own MST tip, which I have no financial interest in, then you don't need to worry about that because it doesn't clog at all.
Okay. Well, you mentioned the balanced tip, which has an interesting curve on it. How does it work? Why is it different from standard straight or Kelman tip?
It's different from a Kelman tip because the curve is in a different place. And what it means is that the actual bevel is in the same line as the shaft. And Alcon did this because they found that the heat signature at the wound was not as low as they'd like it to be with a standard Kelman tip. With this one, because it works differently, the heat signature at the wound is much lower. The other thing about it is that the actual excursion of the tip going side to side, which is what it does with torsional, is greater, and this is what makes it more efficient, because as we know, power is the function of the movement of the tip. It's not about the frequency changing. So because this has a greater excursion than a standard Coleman tip, it's more powerful, therefore you reduce the power from 100% to 60%.
More efficient. What are the sort of key changes in the fluidics and parameters that a cataract surgeon should look at and should alter to maximise their efficiency and in Phaco?
Most modern machines now have some form of active fluidics. This means that, for example, in the Stellaris machine or in the Dork machine or in the Opticon machine, they are actually pushing fluid into the bag to increase the flow of irrigation fluid coming into the eye. And this helps to keep the chamber stable. The disadvantage of that is it means that you're operating a lot of the time with a really fairly high intraocular pressure. On the Alcon machine, the Centurion, this is very different because the preset that you make as a surgeon is the intraocular pressure that you want to exist during the course of your operation. So you can start down to about 30 millimeters of mercury and go up to about 80 millimeters of mercury. And what you'll see is that the chamber will remain stable. And the reason it remains stable is because there's a bag inside the top of the machine. It's got a paddle that pushes against it. And this pushes in such a way that it keeps the intraocular pressure constant, which minimizes the effect of surge. The other thing that all modern machines are doing is to have non-compliant aspiration tubing, because one of the big problems with the early machines was they had soft silicon tubing, and that encouraged surge to take place because the tubing would actually expand and contract as the fluidics settings were changing. With modern machines, you can use much, much higher vacuums than you could in the past, and it doesn't matter whether it's a Venturi or a peristaltic machine in that regard, although they're different in terms of one being flow-based and the other vacuum-based. They come together much more closely now in the way that they perform. The settings on the Venturis, for example, now can be higher because in the past, when you put your foot on the pedal, you went from foot position 1, irrigation, foot position 2, irrigation aspiration, and foot position 3, irrigation aspiration ultrasound. That meant that you couldn't get into ultrasound until you'd hit your maximum vacuum. With the introduction of the dual linear foot pedal, you could actually cut in ultrasound at any point in your position of movement in foot position 2, just by moving your foot to the side. This doesn't matter in a peristaltic pump, because you're not going to get vacuum until you've got occlusion anyway, so it's no longer an issue.
What about sort of rise times? And on some machines you can program different rise times. How would you select which one to use? I
think this is a function of the experience of the surgeon. If you've got a trainee, they won't necessarily want their rise time to go up too quickly. In fact, on the Infinity, you could slow down the rise time. Yep. On the Infinity also, you had various settings to increase the rise time. On the Centurion, you can't do that. You can increase the rise time on the Signature Pro. And what this does, particularly if you're using it in peristaltic mode, it means when you get occlusion, you get up to your preset vacuum as quickly as possible. And this is really useful if you're chopping, because you're going into the piece of nucleus, the vacuum goes up very quickly to where you want to be, and then you can make your chop maneuver.
And what advice would you give to someone who's perhaps new to a machine, presented to them, and where do they start in setting it up?
Well, hopefully, the theatre nurse will have been fully briefed by the company rep. But also, if they're not, then you get the company rep in, they give you a tutorial, they sit in there for your first few cases, and you find what you're comfortable with, because people have different settings for different things, depending on what style of phaco they're used to using, what particular technique they're using to break up the nucleus, whether they like things to happen faster or slower. I mean, when you go to a new machine, obviously things are going to be a little bit different. But a lot of the time with modern machines, they're comparable. And if you put in your old settings and you've got a similar size phaco tip, and you put your bottle height the same height, then you'll probably be okay.
But it is very much personalising the machine
absolutely.
for your
Definitely.
settings. Yeah. Richard, thanks very much for coming and talking to us today.
Great pleasure.
Thank you. So for more information on this and related topics, please visit us at eurotimes.org. Thank you.